Have you ever wondered how sildenafil works for erectile dysfunction? Is it safe? What dose should you take? And what are the possible side effects? In this video, we'll explain everything you need to know about sildenafil, from how it works and when to take it, to important safety precautions and who should avoid it. This video is for educational purposes only and is not a substitute for professional medical advice.
What is erectile dysfunction? Erectile dysfunction, or ED, is the inability to achieve or maintain an erection that's firm enough for satisfactory sexual activity. It's a common condition that becomes more frequent with age, but it can also affect younger men. Causes include diabetes, high blood pressure, heart disease, stress, anxiety, smoking, obesity, certain medications, and hormonal problems. While occasional difficulty with erections is common, persistent ED should be evaluated by a healthcare professional because it can sometimes be an early sign of other health conditions.
What is sildenafil? Sildenafil is a prescription medication commonly used to treat erectile dysfunction. It belongs to a group of medicines called phosphodiesterase type 5 inhibitors, or PDE5 inhibitors. It's also widely known by the brand name Viagra, although generic sildenafil is available in many countries. Sildenafil helps improve blood flow to the penis, making it easier to achieve and maintain an erection, but only in response to sexual stimulation. It does not increase sexual desire or libido. How does sildenafil work? During sexual stimulation, the body releases nitric oxide, which increases a chemical called cyclic GMP. This relaxes the smooth muscles in the blood vessels of the penis, allowing more blood to flow in. An enzyme called PDE5 normally breaks down cyclic GMP. Sildenafil blocks the PDE5 enzyme, allowing cyclic GMP to remain active longer. As a result, blood vessels stay relaxed, blood flow improves, and an erection becomes easier to achieve during sexual stimulation. Without sexual stimulation, sildenafil usually does not produce an erection. Dosage and how to take it. The usual starting dose for most adults is 50 milligrams, taken about 30 minutes to 1 hour before sexual activity. Depending on how well it works and whether side effects occur, a healthcare provider may adjust the dose to 25 milligrams or increase it to a maximum of 100 milligrams. Sildenafil should not be taken more than once in a 24-hour period. It may work best when taken on an empty stomach, as a high-fat meal can delay its onset. Avoid taking more than the prescribed dose, as higher doses increase the risk of side effects without necessarily improving effectiveness. How long does it last? Sildenafil usually starts working within 30 to 60 minutes. In some people, it may take a little longer. Its effects can last for up to 4 hours, although this doesn't mean you'll have a continuous erection during that time. Sexual stimulation is still required for it to work. Common side effects. Like all medicines, sildenafil can cause side effects. Common side effects include headache, flushing or warmth in the face, nasal congestion, indigestion, dizziness, mild changes in vision, such as a blue tint or increased sensitivity to light. These side effects are often mild and temporary, but if they persist or become severe, contact your healthcare provider. Serious side effects. Although uncommon, some side effects require immediate medical attention. These include chest pain, sudden loss of vision, sudden loss of hearing, and an erection lasting longer than 4 hours, known as priapism. Priapism is a medical emergency because it can permanently damage the penis if not treated promptly. Who should not take sildenafil? Sildenafil is not suitable for everyone. It should not be taken with nitrate medications, such as nitroglycerin or isosorbide mononitrate, because the combination can cause a dangerous drop in blood pressure. People with severe heart disease, recent heart attack or stroke, very low blood pressure, or certain inherited eye disorders should speak with their healthcare provider before using sildenafil. It's also important to tell your doctor about all medications and supplements you're taking, as some can interact with sildenafil.
Common myths. Let's clear up a few common myths. Myth 1. Sildenafil increases sexual desire. Fact, it helps with erections but does not increase libido. Myth 2. More tablets work better. Fact, taking more than prescribed increases the risk of side effects. Myth 3. It works instantly. Fact, most people need to wait about 30 to 60 minutes, and sexual stimulation is still necessary. Final advice. If you have ongoing erectile dysfunction, don't ignore it or rely on self-medication. ED can sometimes be a sign of underlying health conditions, such as diabetes, high blood pressure, or cardiovascular disease. A healthcare professional can help identify the cause and recommend the most appropriate treatment. Never use sildenafil without medical guidance if you have significant heart problems or take medications that may interact with it.
Thanks for watching. If you found this video helpful, consider subscribing for more evidence-based videos on medicines, health, and pharmacology. If you have questions about sildenafil or another medication, leave them in the comments, and we may cover them in a future video. Stay informed, stay healthy, and we'll see you in the next video. Disclaimer: this video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease, and should not replace advice from a qualified healthcare professional. Always consult a licensed healthcare provider before starting or changing any medication.